So the COVID vaccine is very, very effective. And we are seeing this business that people, even doubly vaccinated, might get infected. However, what we tend to see is that it still protects people from dying, unless they are particularly extremely vulnerable people, and protects from the most serious effect of the disease. We don't have a hospital full of people with COVID, do we? So this is where the difference comes. Also, there is preliminary evidence that the people who are doubly vaccinated might test positive, but the virus doesn't stay very long. And therefore, the consequences is they cannot transmit it for very long. And this is why you are breaking down the chain of transmission too.
We're coming up to the autumn now. It's a time prevalent with respiratory diseases and colds and flus. As a specialist who's been working with these scenarios across the world, what can you tell us? What's your forecast for the months ahead?
We can make some observations. Of course, with winter coming, people tend to stay more inside. And because this is a respiratory disease, yes, you can think of, I might see an increase in transmission. Because, the school reopening, people come back from holidays, they might go back to offices, etc. So more concentrating people inside, you might have an increase in transmission. However, to counterbalance that, there will be more vaccination. So more people will be vaccinated. And as I said, the people who are vaccinated, even if they get infected, it does appear that they are not as good at transmitting as people who are non-vaccinated. Also, we're going to extend the vaccination to younger groups. And again, so you are covering more and more of your population. And this is starting from a base which is excellent, because you have one of the highest coverage already in the world. So you are in a very good position, and hopefully things shouldn't go wrong and we shouldn't see a repeat of what was last winter when there was no vaccine around. The only variable there is whether a new variant selects itself, which is going to be highly resistant to the vaccine. And this is not something we can exclude. Maybe one observation, one point that people should bear in mind is this. If you have a population which is non-vaccinated and you have a lot of cases, there is a lot of virus circulations there. And every time the virus reproduces itself, can change, can mutate. This is why we're seeing those variants. We started with the Kent, and then the Delta, the one in South Africa or South America, etc. When you're vaccinated, what you do, you prevent people from developing the disease. So the virus can't reproduce at such a huge rate, so you reduce the risk of variants. And this is why it's so important, the vaccination.